Valerian versus Oxazepam. Effects on the body. Valerian is an anti-anxiety and a sedative, as well as Oxazepam, which is also an anti-anxiety and a sedative. The system these two drugs affect is the CNS system. They depress the CNS system by increasing the amount of GABA in the body, and GABA is an inhibitory neurotransmitter. Both have similarities and differences to each other. The first similarity is they both depress the CNS system by increasing GABA, as previously stated. Both are anti-anxiety and sedative hypnotics. Both are contraindicated in pregnancy and breastfeeding, as the safety has not been researched and it does seem to cross the placenta. And both will have a benzodiazepine-like withdrawal after long-term use. Both will assist in treating anxiety and improving sleep in an individual. The differences between Valerian and Oxazepam is Valerian is a complementary and alternative medicine, and Oxazepam is a benzodiazepine. You can get Valerian over the counter, however, you do need a prescription for Oxazepam. The research for Valerian is not extensive. However, the Oxazepam is FDA approved. The Oxazepam can treat alcohol withdrawals and Valerian cannot. It is not strong enough. And the Oxazepam is a Schedule IV drug. A Schedule IV drug means that it has a low possibility of abuse, and Valerian does not have a schedule. The Valerian onset is 30 to 60 minutes, and the Oxazepam onset is between 45 to 90 minutes, and that is a very slow onset for a benzodiazepine. Lastly, the Valerian comes as a tea, extract, tincture, and capsule, and the Oxazepam only comes as a capsule and tablet. Next, we're going to talk about the side effects and the similar and different side effects these two medications have. Valerian and Oxazepam both cause drowsiness and a headache. Oxazepam uniquely causes dizziness, constipation, diarrhea, nausea, vomiting, and weight gain. And Valerian uniquely causes dry mouth as a side effect to individuals. The adverse effects of these two medications are similar in the fact that they cause benzodiazepine-like withdrawals. However, Oxazepam uniquely causes slurred speech, respiratory depression, drug-induced hepatitis, and leukopenia. You can get an anaphylaxis reaction with Valerian, however, it is not commonly documented. Here are the dosage differences between Valerian and Oxazepam. Valerian can be drunk as a tea 1 to 5 times a day in 150 milliliter cups, and each cup is prepared with 2 to 3 grams of the valerian root. As a capsule, tincture, or extract, you would consume 3 to 600 milligrams per day. Some people consume up to 900 milligrams per day. And for Oxazepam, you need a lot less. The capsule and tablet is consumed in 10 to 30 milligram increments 3 to 4 times a day. And so it's a lot less for the same or a higher effective rate. So which do you choose? It's very dependent to the condition. If you have a hard time going to sleep or mild anxiety throughout the day, Valerian is definitely the best alternative to Oxazepam because it's not as strong and doesn't have as many adverse side effects. However, if you do suffer from severe insomnia or anxiety to the point where it is interrupting your everyday life activities, then I would suggest seeing a doctor about a possible prescription for Oxazepam because the adverse reactions will not be as great as the benefits of the medication.